Hello friends, in this presentation we will be discussing about patients avoiding vaccination just because of the reason of allergy. How did I come across this point is that I was practicing in my outpatient department. As I was practicing, few patients I questioned them, did you have your vaccination, COVID vaccination? On asking that question, they simply refused and said, no, doctor, I didn't have my vaccination because of my allergy. I am allergic to penicillin drugs, I am allergic to sulfur drugs, so I didn't have my vaccination. So another patient, I asked them, why did you have your vaccination? No, I have allergy to prawns, I have allergy to fish. Generally, I have allergy to several foods, so I didn't have my vaccination. So at this point of time, I like to enlighten you about what is allergy, what is anaphylaxis, and about the vaccine production, how a vaccine is created. So what is allergy? Allergy is a hypersensitive immune reaction to a particular product. It may be household dust, it may be for cockroach, it can be for cotton, it can be for fish, it can be for dried fish, it can be for prawn, it can be for crabs, it can be for brinjal, it can be for chilies, it can be for penicillins, it can be for sulfur drugs. Do we have to stop vaccination if I have allergy to any of the above what I have mentioned? My answer is no. So, patients or persons who are allergic to anything else need not avoid this vaccination. Even at vaccination centers, few of the staff nurses or sometimes my fellow colleagues who are unaware of this subject, they say whenever patient comes for vaccination, if you have allergy to anything, please no vaccination. It is not like that. So why was vaccination and allergy linked together? For that we need to understand some history. Earlier in the period when vaccines were derived, vaccines were discovered and produced, they were produced from chick embryo, that is the egg of a chick. So persons who were allergic for chick or chick embryo or the chick flesh were advised to avoid vaccinations developed from chick embryo. But vaccines produced in this 21st century, vaccines are produced by recombinant DNA RNA technology from human diploid cells. So they are manufactured from almost biosimilar human cells. So persons who are allergic even to chick embryo or chicken or chick eggs can also have these vaccines because these vaccines are derived from human diploid cell. So the learning at this point of time is persons having allergy for any of these above what I have mentioned like brinjal, fish, crab, penicillin, sulfur need not require to avoid vaccination just because they have allergy. So who are the persons who are having allergy need to avoid this vaccination is your next question. For that we need to understand what is anaphylaxis. Persons in their previous history would have developed anaphylactic reactions for a particular vaccine. For that you need to know what is allergy, what is anaphylaxis. Allergy is a hypersensitive reaction where you will develop some map-like erupted places on your skin. You will feel your swollen eyebrows, you will have some swollen lips, you will have almost itching all over the body. This is allergy and this is defined as hypersensitive reaction. So what is anaphylaxis? Is an exaggerated allergy. The patient is going for a cardiogenic shock where the heart fails to pump the blood and the patient becomes blue with cold peripheries and they become very cold and clammy with uprolled eyes and they fall down. So at this juncture what we have to learn and listen is that persons who are already having history of anaphylaxis for any of the vaccine should avoid this vaccination. So at the end of this presentation, my job is persons having anaphylaxis or allergy for any of the household products or any of the edibles or any of the animal products need not avoid this vaccination. They can go ahead with the COVID vaccination if they are fit medically. So, persons who need to avoid vaccinations are those who are already having some allergic experience for any of the vaccinations given prior in their childhood. With this important information, I would like to sign off. Dr. B. Shankar here on 30th April 2021, and I would like to meet you in the next video with some important information. Until then, bye-bye.